新加坡昕余传媒受国际ACC 总会副主席庄燕华女士的邀请，跟随新加坡义诊医疗团赴非洲莱索托做特别专访。2023年3月17日至29日，国际文化记者韩昕余女士对莱索托国家前总理、现任卫生部长、义诊医院院长、医生、当地华商、孤儿院院长以及老师和学生代表做了精彩的访问。大家好，这里是新加坡昕余传媒，我们在非洲的赖索托 ACC 园区访问赖索托的国家部长和医院的院长，关于新加坡义诊团在赖索托的发展和未来。谢谢大家。
Hi, so for the first question, can you give a brief introduction to the situation currently in Lesotho in any way that you can think of? The current situation.
Thank you so much. I need to put my focus on the health system in Lesotho. Well, our health system isn't that very much good. We still have some challenges where we are bound by the circumstances to refer our patients to South Africa. There are some certain areas where we are unable to treat our patients here in Lesotho, more especially patients in the area of cancer. We still refer a number of our patients in South Africa, and that comes with a very high cost on our side as the government of Lesotho. And I will humbly extend my special plea as the Minister of Health to the Singapore team of doctors that when they get home, if there is anything that could be done to assist Lesotho to reduce the rate of referring the patients to South Africa, we will gladly receive that as the government of Lesotho.
这是第一个。OK， 尊敬的部长阁下，那么 ACC 进入赖索托这个国家之后呢，在您和这个国家的机构的这个帮助之下呢，取得了非常大的发展。那我们就想请您谈一下，ACC 在赖索托对帮助到当地的生活和人民的文化，在哪些方面做出了一些贡献？谢谢。
So how does ACC, having entered Lesotho now, bring about an impact, changes, especially to the health and the medical community of Lesotho itself, to the people? What kind of impact? Is it good? Is it bad? Or you can explain any way you can?
Thank you so much. ACC Lesotho, much as we have had the center for the past 12 years now, but it is for the first time that we have this program of exchange of doctors who are going to be with us here for a whole 1 week. We are hoping that it will make a very big impact. We are expecting that about 1,000 patients will be seen by the ACC doctors who are here in Lesotho. So apart from that, when we look at the center on its own, how it operates, it has made a very good impact. It has changed the lives of many of our orphans. In the past, before we could have the center, we did not have the orphanage home where we could keep our children, but now it started mobilizing the orphans from around Mafeking district. But it has now expanded, and the coverage is now the whole country. Orphans from different districts of Lesotho are coming here to Amitofo, and they are trained, they get a quality education, they are taken care of. Some of them have gone as far as furthering their studies at the tertiary institutions, and that is quite good. Children who did not have parents, they are now going to be on their own. They have been assisted, and they will be able to be employed because they got a quality education from Amitofo.
OK， 那么 我们国家政府啊，包括我们卫生部啊、教育部啊，那么对我们这个 ACC 在这边的发展和未来有些什么想法？比如说，希望他们未来能够发展到一个什么样的规模？谢谢。
What do you think? What do you expect in the future? What can ACC itself contribute to the society? What can we do more to help the people, or maybe we can help in, let's say, more than certain stuff, like not more than medical, maybe education, or maybe lifestyle. What kind of impact do you wish us ACC to bring in the future, or bring even more, do even better?
Like the former Prime Minister had said in his speech when he was delivering a speech, that I was whispering to him that how I wish that the team can at least come to Lesotho almost every year.
Yeah.
I'm suggesting that because we have realized that with the expertise that the Amitofo team has,
yeah.
Those are the skills that we do not have, and those are the skills that we think if we can have every year, we will have a number of our patients who will be treated here at home. Over and above that, my humble request is that maybe we should agree on the program where our medical doctors on the side of Lesotho can go to Singapore, then be trained, and when they are trained, then come back to Lesotho.
Okay.
You will recall that when I was delivering my speech, I highlighted 4 points which I said those are the priorities of the Minister of Health in Lesotho. I said we are now in the process of constructing a cancer center.
Okay.
Even in that construction of a particular cancer center, we still request, if possible, the ECC team can extend a helping hand. If it's possible, we would also request that the Amitofo avail some scholarships for Basotho nationals to go and further their studies, especially in the medical field, so that we have doctors who specialized, doctors who are well equipped with skills that they would have got from the training in Singapore.
OK， 我们看到赖索托的政府啊，一直以来对于 ACC 的支持，包括对于慈善事业的支持。那么我们相信未来的 ACC 也会有更好的发展。那么我们也想请问啊，部长阁下，那么我们赖索托是不是也希望更多的像 ACC 这样的慈善机构进入这个赖索托的国家，并在这里帮助弱势群体？谢谢。
The next question. So you have talked about ACC bringing a good impact to the people here, and in the future, do you wish for more such organization to enter Lesotho to contribute even more help, as well as not just through the charity, maybe through other mediums, and basically more international help other than Singapore itself?
Like I said in my speech, that you came at an opportune time where Lesotho is trying as much as possibly can to try to reduce the rate of referring patients to South Africa. I think it is important that the Amitofo or CCD can maybe help Lesotho by frequent sending of doctors to Lesotho to train our doctors locally, so that they can have the skills that the doctors from Singapore, from Malaysia, from UK have. So we are hoping that if there can be that exchange program of skills where we have doctors like we do now, then ours will be able to understudy them and then have the very same skills that those from abroad have.
OK。
Just add one more thing. So will you explain a bit more about what kind of support can we expect from the government for this program? Like, is it they make it, let's say, a visa easier to get, or maybe easier for other people to get in, help people without going through bureaucracy, without going through paperwork process, to make it easier for people to help. So we want to know what the government support for this program in the future.
I think every beginning has some challenge. It was at the beginning now that we have this exchange program, and I do understand that we should have encountered some problems. But in the future, we'll make sure that our Department of Home Affairs, together with our Foreign Affairs Ministry, they liaise with the Amicofo in Lesotho, so that when you travel, you do not encounter some problems when you come to Lesotho. We'll make sure that that happens.
谢谢部长阁下。我们新加坡的媒体之所以来到莱索托，也是希望全世界都能够关注到莱索托，希望能够在这边帮助到弱势群体。那么现在我们想请院长阁下谈一谈，就是义诊团来到以后跟医院的这个配合，得到了您的大力支持。那么您有一些什么想法吗？
We as Singapore media will hope in this video to let the Singaporeans, other people from international, know more about Lesotho itself and the problem it's facing and the help that it needs, as well as the possible government support to make things easier. So next, we're going to ask Doctor more about the question about medical. How does ACC itself, like they bring in doctors, medical as well for minister, say, train the doctors. So as a doctor yourself, what do you think then? What do the doctors here truly need for the next 2 to 4 years? Short term, what do they truly need? Medical lessons or experience at doing the surgery itself?
Thank you very much. And really thank you for the questions. I think this has come at the right time for us in Lesotho, because it has come at a time when we are trying to rebuild ourselves and find ourselves so that we can improve our health services. We really think the team that has come here, we should have been here a long time ago, because we do have a lot of challenges in terms of specialized medical services, like for instance maxillofacial, dermatology, and infectious diseases, which we are trying to build up. But above all, what my honorable minister just pointed out, we are trying to find a way of cutting down the referrals outside the city, so that most of the things we can be able to handle here. That can be done in phase. One is to say, if through your team, we can be able to capacitate the local young doctors, so that they can be able to liaise the doctors who have come, so that they can learn the skill. And then once they have shown themselves the interest, they can be trained a little bit more, so that they become specialists as well. The second phase would be to say there are certain areas like maxillofacial, which will take a little bit of time for us to be able to do. But then that can be done on a stacking services, where the doctors can come at a certain stage of time with patients that already have been identified so that they can do the work. And that will be very helpful for us. The third phase will be the one when we say now, we go into actual training of our doctors to specialize. That would be in the long run. But we should have identified them earlier. And then I think that would be very helpful for us. And then that will help us also to reduce the burden of having to refer patients outside our own country every now and then.
非常感谢院长阁下，这些年一直对新加坡义诊团的支持，也得以让这个义诊团在赖索托这个国家能够扎下根来，并能够产生很好的效果。谢谢您。
Thank you for both your supports for this ACC to be able to do the work, contributions to help contribute even more to Lesotho in the future. Thank you so much.
Thank you.
那么我还想请问两位阁下，你们有没有想跟我们的观众要说几句话？
So the last question is not a difficult question. Is there any words that you want to tell to the international audience that you want to say out from your heart to them? They say anything one.
部长阁下，请。
And say to the international audience what you want to say to them directly.
Yes, we are very thankful to have a team here. For the international community, we need an assistant to be able to build our health system. We are working on the National Referral Hospital, catering for the whole country. from all the people. And then it has to have all the equipment that is required, the human resource that will be required, and make sure that it has got the supporting services that are up to standard. For that to be done, we need a lot of international support.
OK，
Lastly, the priorities that I have set as the political head of the ministry, one, it is the integrated provision of health services. There is no problem with that. We are planning to strengthen our primary health care. But secondly, and most importantly, like I earlier indicated, to make sure that the only referral hospital that we have, it is working efficiently and effectively. And in order for us to get there, we need to be assisted by the international community through sharing skills with us, assisting us with the medical equipment, like you have just brought us some medical equipment here, and we are thankful with that. Lastly, we are in a process of building or constructing a cancer center, and even on that, we would humbly request that if the international community would like to extend a helping hand, we will gladly accept that as the government of Lesotho.
OK，
Thank you.
Thank you， 非常感谢今天2位阁下接受我们新加坡昕余传媒的专访，再次谢谢。
Thank you.
没有什么不能改变，没有万物能实现。我站在未来争取些，带着迎接每个考验。海阔天空是我的地图，向下向前行进路，看眼天在等我去征服。人生尚未夜，但带着灿烂的日出。